Hi, Dave from Informed American here, back again, joined by my special guest, Dr. Paul Zeitz, a physician, epidemiologist, talking about the latest developments on COVID-19 pandemic. Dr. Zeitz is the author of Waging Justice, A Doctor's Journey to Speak Truth and Be Bold. He's also worked for the Obama and Trump administrations, director at the Global AIDS Alliance, the Arizona Department of Health and Services, the CDC, an entire stack of his resume, but maybe above all of that, you were an absolute pleasure to talk to last time, and I love your way of breaking down complex problems like the global COVID-19 pandemic. So thank you so much for coming on again.
Hey, Dave, it's great to see you and great to be back. Thanks for having me.
Absolutely. Last time we talked, it was late April, I believe, April 30th. And we're on, I'm sure I'm not the first person to say this, but it's the COVID-19 time paradox, where things feel like they both happened yesterday and, 10 years ago. It's really hard to get a sense of things.
Yeah, that was 10 weeks ago. Okay, so thank you for that reminder. It's been quite a head-spinning 10 weeks, right?
Yeah, absolutely. And the world has seemingly changed again. But yet we're still battling through this COVID-19 pandemic. So we solicited questions from our readers, from our followers, and I've kind of edited them together and just going by main topics to try to hit some of the big ones. So if you're ready to go, let's start.
Fire away.
All right, let's get right to the possibly the silver bullet, this thing that we've been talking about: vaccines, treatments, therapeutics. How far away are we, Dr. Zeitz, on a vaccine?
So the effort for a vaccine is moving at a very rapid clip, faster than I've ever seen any vaccine attempted to be developed. The U.S. government has launched something called Operation Warp Speed, and they've appropriated over $1 billion, I think it's $1.6 billion, to manufacture vaccines, develop and then manufacture vaccines. I don't think this has ever happened before, but they're actually investing in manufacturing capability for several candidate vaccines that are possibly going to work. So they're pre-investing in manufacturing capability. Now, in terms of actual candidate vaccines, there is a vaccine candidate being developed by a company called Moderna, which is going into what's called a phase 3 clinical trial, where they're going to offer the vaccine to 30,000 people, a group that gets it, a group that doesn't get it, ensure that it's safe, ensure that it's effective with a broader range of people. It takes time to enroll, that many people in a study and then track it over a period of time. That study was supposed to be launched last week, but it got postponed because they're tweaking the protocols. So, vaccine development is highly complex. The data that you collect has to be highly accurate, and it takes time. There's also an international vaccine effort being led by the World Health Organization, the European Union, China, other countries. There's over 60 candidate vaccines that are being looked at right now. Wow. So again, we're only 6 months into this pandemic, or 7 months now, and we have over 60 candidate vaccines. I don't think we're going to have a vaccine personally. I think the idea of having one this year or even early 2021 is unrealistic. I think we're talking at least another year or two before you have a vaccine that I would feel safe taking myself or recommending for my mother. The head of NIH has recently said that you might need to have a combination vaccine. So of all these candidates, you might need to have 1 + 2 to get the 3 boost that you need to get the immune response. So again, there's never been a vaccine for a coronavirus. It is an RNA virus like the HIV virus. We've been working on an HIV vaccine for decades and still don't have one. So I'm cautiously optimistic that within a couple of years we can have one.
So then so we've got a while to go here, even though these are unprecedented efforts. It just simply does take time. It doesn't seem there's any way to shortcut that, unfortunately.
Yeah, you don't want to bypass the safety and efficacy steps. It could be dangerous too, right? We know we have those experiences too.
Now, how effective do you imagine, I think you said about maybe doing a booster. So this won't be something as effective as like a polio vaccine. Will it be closer to a flu vaccine in terms of effectiveness? What's your anticipation?
I think it's too early to tell. I mean, the flu vaccine, as you know, is an annual vaccine, and every year the envelope of the influenza virus changes every year. It mutates every year. So every year there's a new vaccine that's developed that is based on what they think is going to be the strain circulating in different parts of the world. And so, and then, those vaccines can be 40 to 60% effective. So they're not 100% effective. Polio vaccines are more effective. We have an oral poliovirus and an inactivated poliovirus vaccine that are, over 90% effective. But you do need multiple doses. So we don't know yet about what we're going to need to do for COVID-19. It's strange now because there seems to be an antibody response. There seems to be neutralizing antibodies that are developed by the body for people that are infected, but it's still not clear how long those antibodies will last. And it's not clear which of those antibodies are the ones that would be most effective to stimulate through a vaccine. So there's a lot of work going on to figure all this out about the immune response and how that will translate into the best optimal vaccine protocol.
Now, as we wait for a vaccine, what about therapeutics and treatments? There's been some promising ones that seem to be pretty good, and then maybe not. Remdesivir is the first one off the top of my head. And that one seems very expensive as well. What about maybe that, just as sort of a stopgap measure until we get a vaccine, just to maybe help the most vulnerable in the population? What's the outlook on that?
Yeah, remdesivir is a Gilead pharmaceutical agent that was approved by the FDA based on some early studies. And just last week, there was a new study that came out that showed that remdesivir had a 62% reduction in severely ill people, reducing the risk of death by 62%, which is actually better result than the initial trial that led to the early approval. So remdesivir is widely being used now for very sick patients. There's a big demand for it. Unfortunately, the U.S. government did some maneuver, which I don't fully understand, that secured the stock only for the U.S. And that is obviously, of course, I'm an American and I want everyone here to get access to it. But,
right.
There are people around the world that would also benefit from this drug. And there are ways of developing generically manufactured products that could be widely distributed globally. And I am an advocate for that. And we have to really think for any of these therapeutics, like this one's working, we have to, it was a U.S. company that developed it, and we are applying it in the U.S. And we also have to figure out ways to make it available globally, in my opinion. And we have to do that in cooperation with the World Health Organization and other governments. And that's true for vaccines. And there are other therapeutics. The hydroxychloroquine, the anti-malarial drug, WHO recently halted studies on that because there was no data that it was reducing death. There are still trials going on about that as a preventive.
Is that the most politicized drug in history, or what?
Unbelievable, yeah. And also, there are literally, I think, there are about over 250 to 300 different therapeutic agents that are being studied around the world. The other promising thing that's already being used is plasma. People that have been infected and they develop antibodies, they are being invited to donate their blood or their plasma, which is like the liquid around the blood cells, and donate, which is where the antibodies are, and then donate that antibody-rich plasma to very sick patients. So,
can I ask you a stupid question? Can you
no stupid questions. No, I won't answer it.
Okay.
No, I'm joking. There are no stupid questions. Sorry.
No, but we'll see. Well, can you make a synthetic antibody?
Yes, you can. We have biotechnology capabilities to develop what are called monoclonal antibodies. That's a really good question because now there's all kinds of research going on in the antibody response. So the body gets infected by this virus. It bombards it with antibodies to try to kill it and attack it. And in the research environment, they're able to collect all those antibodies and then figure out what are the different kinds of antibodies. Mm-hmm. You have antibodies that are being created for different parts of the virus. And what they're finding is that the antibodies that are for the spike that thing that sticks up from the coronavirus.
Yeah,
There's spikes all around it. Well,
that's where it
actually,
gets its name, right?
the spikes are where the virus binds to the human cells.
Hmm.
And so they're now finding that there are antibodies just for that spike. If they can collect those and then replicate them and produce them through a monoclonal antibody mass production, that's what they're aiming to do. And then also that informs the vaccine protocol. You want to get a vaccine that's going to stimulate antibodies that will block the spike protein. So it's that level of work underway right now.
Wow, that's fascinating, and I definitely see your interest in epidemiology now. It is a fascinating world. So let's move on from there. So hopefully something there with the therapeutics and maybe some other treatments as we wait for a vaccine. But maybe let's hit maybe the most contentious thing that's going on right now, which is the opening of schools in the fall. A number of places, I believe it was news just maybe a day or two ago about Los Angeles and San Diego saying they're not going to start the school year in class. They're going to do it online. And I believe in Florida, they're pushing to open. So certain places are wanting to open, certain places not. But it's a complex issue. And how do we get schools open, Dr. Zeitz? Since that's the goal, since that's the thing that everybody wants, how are we going to get there?
Thanks, Dave. Yeah, that is our common interest. I agree that who doesn't want their kids to go back to school?
Right.
And that includes preschool through elementary, high school, and universities. Their whole educational system from that, all those age spans have been dramatically affected by this. It's very painful and difficult for families and for the children themselves, and there are learning delays and all that.
Yeah.
So thanks for articulating it that way, that is our common interest. The question about opening up schools is a challenge. As you said, there's not a lot of data that can guide these policy decisions. There have been countries in other parts of the world, in Northern Europe and Israel and others, where they were able to contain the virus, flatten the curve all the way down, get it down to low-level transmission, and then once they achieve that, they have been able to reopen schools, and they had outbreaks. So one of the things that we've learned is that for managing, is that you need to do testing, contact tracing, and isolation as a public health approach. So if you have an outbreak, you rapidly identify it, you contain it before it spreads.
Right.
And you test people, check all their contacts, and isolate any positive people, and make sure the most vulnerable people are protected. So in Israel, they were able to do that. Okay, you have an outbreak at a high school, you go in there with your public health measure, you contain it so it doesn't become community-wide transmission again.
Gotcha.
So I think in the United States, as we're grappling with reopening schools for the fall, we really have to look at what is going on at the community level. Is the virus contained within the community? Have we been effective at lowering transmission down to a low-level throttle? And do we have that public health response, the testing, contact tracing, and isolation programs up and running? There was a recent, and I'll send this to you, True People Research did a rating of all 50 states about how they were doing in implementing these protocols. So as you can imagine, it's highly variable. So there are some states that are doing squat bad and others that are doing better. So a place like New York, New Jersey, Connecticut that had really bad epidemics have successfully brought the curve way, way down. They're keeping it down so far. They've invested a lot of time and money in testing, contact tracing, and so forth.
Right.
In those environments, I would recommend I'd be more proactive in moving towards opening schools in a safe way. If you have a generalized community-wide epidemic that's out of control, like what we're seeing in Florida and Arizona and Texas right now, in major cities there and even rural areas, I think opening schools is just going to continue to feed that community-wide transmission. So for every 100,000 people that get infected, the case fatality rate is 1% roughly. So you get 1,000 people that are likely to die, even with these therapeutics. I mean, hopefully we can reduce the case fatality rate to 0.9 or 0.7 or but it's still 700 out of every 100,000, will die. So, it's a tough call. The other thing that we're seeing, sorry about that buzzer. The other thing that we're seeing is that people that recover from COVID infection, some of them that have had moderate or severe illness are having long-term effects. Now, we're still studying all that, but it's not. We shouldn't be blowing off all the people that are getting infected and not dying, because people are getting very sick and having long-term problems.
Yeah, absolutely. So so it doesn't seem like we're quite there yet. And, maybe if we need to start school virtually around the country, and maybe if we can get this thing under control within the next few months, maybe it's sort of a touch and go thing then, right?
I think it has to be locally determined. But I think what happened was when we were in sort of lockdown from mid-March till the end of April, and then the policy environment from the federal level shifted towards pressure for open. Many governors were opening. In states where there was a flattened curve and they had succeeded in containing the epidemic, they reopened cautiously. We've been able to keep transmission low in those areas. Mm-hmm. But in places where community-wide transmission was still on the upswing, and then you reopened, that was the formula that we talked about at the end of April that was going to lead to community-wide transmission, which is unfortunately exactly what's happening. My concern now is that I think in the United States, 42 states and territories out of, like 55, including like DC and Puerto Rico and the other islands, are seeing increasing transmission rates. So for the few places that have kept it contained, I'm really worried, because of the mobility in our country, that everywhere is going to see another round of a community-wide phase, which is terrible.
Yeah, scary stuff. And one of the things to help prevent that is mask wearing. And we keep getting questions about masks. It's something we talked about back in April when it was a new thing, and now it's common. And in fact, in many places around the country, and particularly my county, if you want to go anywhere into a building, you're legally required to wear a face mask, which is something from the beginning. I've been a supporter of masks. To me, it made 100% just plain common sense. But people, we still got more questions about this. So I'm going to read. This one's a little technical. It says, since the best mask available, the N95 mask stops. And I didn't verify these numbers. Only 97% of particles above 1 micron, and the virus measures between 0.05 and 0.2 microns. Would wearing a mask really stop many of the virus particles from being breathed into your lungs? Bottom line, do masks available to the layperson give any protection at all? So maybe not the N95s, because most people, that's not what I see most of the time when I'm going in and out of stores. I'm seeing like the cloth things, or like those 3-ply fake surgical things.
The medical masks. Yeah.
Yeah. Okay. There you go. Yeah. And then also maybe face shields is one we've been getting a question about. So first of all, this idea of the virus is smaller than the pores for the mask. What's that all about?
Yeah, so the virus is spread now through respiratory droplets. So if you're coughing or spitting, it's not like the virus is purely floating from a cough in its own little sphere. It's surrounded by liquid from a respiratory droplet.
With like an engine flying?
Yeah.
Does it work like that?
So, like a cloth mask or a medical mask or an N95 mask, will block the spread of respiratory droplets, which contain viral particles. And so they are effective, and there's more and more data that's come in showing the benefit of all people in a closed space, particularly if they're wearing masks, transmission is dramatically reduced. The other thing that just happened last week, though, just as new information, is that there was still a lot of question about why is this thing spreading so rapidly in the United States and other parts of the world. And so there is been a new review of the literature, which is showing that microscopic droplets, smaller droplets, so aerosolized droplets that are in a closed room can also potentially infect people. And so that is another kind of kind of challenge. So they can linger in
So what's the difference there?
enclosed airspaces.
If I could jump in, because that was going to be one of my questions. In fact, what's the difference between an aerosolized version in the air and versus because so you have the coughing and the sneezing. That's the most common. And as we joked earlier, it's not like the virus is flying on like a helicopter. So what's the difference between the giant droplets that I sneeze and the little tiny helicopter virus? What's aerosolized? How do we?
It's a good question. I don't have the technical details of like the micronic measurement size, but
it's flowing in the air in a different way.
A respiratory, a cough, a speaking, singing kind of are a larger kind of droplet directly from a human. If you're in close proximity, if it's aerosolized, it's a smaller particle. I don't know the exact number, but it can float in the air, and then you could be even at some distance and potentially inhale it. The data is still coming in on this. I think the idea is that we have to be very, very cautious. So especially indoors. And what we've learned now is that most of the cases are being transmitted through restaurants, bars, cocktail parties, indoor close confinement of people is where the transmission is happening.
Yep.
So right now, many states that are opening up have outdoor eating and eateries, and even social gatherings are happening. Church gatherings or family gatherings are happening outdoors. The virus does not survive under UV light, and it's so tiny that any kind of wind or movement blocks, takes it right to the ground, and it doesn't survive in the ambient air. So what I'm worried about, and this is why we've talked about a second wave in the fall going into winter, is that when people are more and more indoors, that it's going to be harder to interrupt transmission human to human. So
yes, certainly. Yes. I understand it completely. And that was one of the fights over opening the beaches. And I never understood the vitriol and the hysteria around it, because I'm thinking, I'm out here, there's a 20-mile-an-hour sea breeze at me. I think I'm okay here.
Yeah. I mean, I agree. It's just the challenge, like, getting to the beach,
right, yeah,
and walking by, walking through all the crowds. Now, you asked about the shields and N95 masks. So we're in a situation where those things are what's recommended as PPE, personal protective equipment, for healthcare workers or for people that are in direct contact with COVID-infected patients. And so, as you recall, in the March-April timeframe, there was such a demand and there was such a short supply for those products. Now, then things got a little better, in May and June, but now with this kind of surge happening across the country, we're again seeing shortages of PPE. We're seeing shortages of laboratory supplies and reagents. Testing capabilities are being overstretched, and also hospital equipment. So the face shields that you asked about, I am recommending that people consider those, like if they have an urgent need to get on an airplane and fly across the country, I would say with an N95 mask and a shield, that would be the best way to protect yourself if you're in a closed airplane for X number of hours. And, many airlines are cramming the planes full. They're not, in Europe, they're doing social distancing on the planes. They're keeping middle seats empty, but in the U.S., that's not happening systematically. So
that was actually going to be one of my questions. Airline travel. So that would be your recommendation: a mask and a shield. Is that the extent of your recommendations for traveling? I noticed that they saw there was a picture of Senator Ted Cruz. I guess you're allowed to drink a coffee or something while you're allowed to take off your mask while you're drinking, while you're on the plane. And then also when you're at the gate, you're not required to wear it, but you are required otherwise when you're on the plane to wear. What would you say? Maybe try to forego the drinking if you can while you're in this tin can flying in the sky. I mean, what would be your best tips for airline travel?
I think people should I would only do essential travel. I don't think we should be doing recreational or voluntary travel. I think it's a high risk zone. The Texas Medical Association put out a great graphic looking at a wide range of behaviors and assessing their risk, even if you're using masks and social distancing. And airplane flying was a moderate to high risk activity in their assessment. So, if you can avoid it, I would avoid it. If you have to fly, I would. The Seattle Times did an evaluation of all the different airlines. They're all different policies. There's no federal rules about that. And so there's some airlines that are taking it more seriously and doing more rigorous public health measures. So I would pick an airline that was doing the smartest way of flying if I could. And I would also try to find flights that aren't full, like fly off hours, inconvenient flying times.
That's good. Yeah, go at 2 in the morning, right?
What's that?
Go at 2 in the morning if you can.
Exactly. Fly when no one else is flying.
Yeah.
And then if I had to fly and it was like a crowded flight or whatever, I would definitely wear an N95 and I would try to find a mask. I don't know if they're publicly available or widely available, the face shields, but there are lightweight ones that are relatively comfortable that medical providers use. I don't want to suck the supply into that when there's an urgent need for PPE, though, in many hospitals that are being overwhelmed in many states right now.
Great. All right, I've cobbled together a bunch of questions into it. It's going to be a little bit long form, if you could bear with me here. This is basically about the United States, something we hit on of how the virus has sort of moved through the country. We had areas like New York, New Jersey, Connecticut that you talked about. And they had, I was just kind of looking at some numbers. About 40% of all deaths occurred in just those 3 states alone. But now, of course, it's spreading into the South. We've got Florida, California, Texas, Arizona, all that. But it leads to another question, which is will this phase look like last phase? In other words, that's kind of the main point. And we got a question here about how the death rate under 40 is very low. So what do we do? Well, maybe instead, should we shelter the elderly in place and let the rest of us go back to work if we could? Just before I hand it off to you, I came across a really nice chart today. If you can see my screen. So, you can sort of see where we are here. In other words, we're getting cases, just to, briefly run through here. We're getting cases in the majority of cases in the 25 to 34-year-old range, rather, while as hospitalizations is 65 to 74. And of course, deaths is 85 and over. So I think you get the flavor there of what people want to know. Look, do I need to worry as much about these cases if the deaths aren't nearly as high, and if the deaths are mostly in the elderly? Maybe we instead of having a top-down strategy for all age groups, should we do something different and to maybe keep the most vulnerable sheltered in place, whereas let those in their middle age and younger kind of try to get this economy back going and get somewhat back to normal? I know that was a really long-winded, maybe 10-part question, but to the best of your ability here.
Yeah, I'm trying to figure out what this chart is on terms of cases. Is that the total number of people that have been tested in that county?
This is, I believe this is Florida overall, all of Florida rather. Sorry, I don't know. I'm not sure if I said that or not. Yeah, this is all of Florida. We got a total of 287,000 cases, 4,400 deaths. This is cumulative, 18,000 hospitalizations. Yeah.
Yeah. Okay. So the thing that I would say about, this seems right. This is just the general pattern that I think is happening around the country and around the world. The thing that you have to remember here is that if the number of cases here that are being reported is the number of people that have been tested so far in that state, which that seems a little bit low, actually. What epidemiologists are estimating is that there have been X million, say there's 1 million people that have been tested in the state of Florida.
Okay.
There's actually 10 or 11 times that amount of people that are 1 million people have tested positive, say. Then actually there's another 10 times that are actually have been infected with COVID. So right now there's been 36 million infections in the United States, I think. What is it? Let me just get the data. I want to make sure I'm speaking accurately. I have my numbers all right in front of me here, or I thought I did.
I've got one up here. Well, I got confirmed here as 3.43 million for the
So
US
3.6 million as of yesterday, right?
Okay.
So then it's actually 36 million or more that are actually been infected.
Yeah.
So about 40% of people infected are asymptomatic carriers. So that's the challenge. So you could have young people that are unaware that they're being infected, and then they're contributing to transmission, community-wide transmission. So then they're encountering all these other people, and then all these other people are getting infected, and then all these people are going, we don't know who's home, who's living with them. Grandma, grandpa may be living with them. Their wife might work at a nursing home and then get infected and take it in the nursing home. We don't know if they have a person that has breast cancer or leukemia that is struggling in their family that someone's getting exposed to. So there was a thought earlier in the pandemic, March, April time, where if we could test people for antibodies, then we would know that they were safe and that they could then get an antibody certificate and then go back to work. That was one kind of idea people had. But it turns out that the antibodies are disappearing in some people, and they're not detectable. And especially people that have minor infections or asymptomatic infections. So they might be able to get reinfected and they might be able to get sick again. We're still studying all that. So I don't think, I hear the question there that we're looking for solutions that can allow the economy to throttle forward and also be realistic about there are people in their 50s, even on your chart, there are people in all age groups that are dying though, right? So, this is I would call this a preventable death. It's like, you're not going to take away seatbelts for 40-year-olds and so because the 80-year-olds are dying more in car accidents, right? You have to think about this as an opportunity for everyone in the whole community to serve themselves by staying negative, but also serving the whole community by keeping transmission very, very low or at a low throttle. We're not going to get it to zero, but we can maintain it at a low level. Countries have done that. New Zealand is almost at zero now, and other countries have, in Korea and Indonesia, Singapore, many parts of China have successfully contained the virus. So we know Germany has done that. So why can't we do that?
That was actually leading right into my last, or not.
I think we're having a telepathic conversation.
It really is right here. One of the examples I was going to use was Japan. They've seemed to be over the hump. They have had, and not only just speaking of health-wise and economy-wise, they were able to sort of get rid of the virus and not suffer economically. But every country seems to be very different, and I don't know, because I'm thinking of Sweden. That's the famous one where they had very small measures taken, and they kept the economy going. Now their deaths are higher, and their rate of deaths are higher than the United States, but they didn't have quite the economic blow that the United States had. So since every country is different, they certainly didn't have identical policies. What was the real difference there?
Well, there's several factors. One is that we haven't talked about yet is that there is some evidence that the virus is mutating. And the current strain that's circulating globally in Latin America, in the U.S. and Africa, and globally is actually more infectious and transmitting more easily. So there are changes that are happening with the virus itself, which is bad for us. Japan was probably originally infected with the original Asian Wuhan strain. And that was less infectious. They were able to contain it. They have they implemented rigorous public health measures. It is an island, so in some ways they can control their situation a little bit easier than we can. I think that they probably waited till they had it under control before they reopened. That's the problem with we don't have an effective national strategy that is containing the virus. In fact, we have the opposite happening. Like, the virus is increasing rapidly in your environment, open up.
Right.
We have, the virus is spinning out of control. we're going to cut off your money if you don't open up your schools. I mean, This is insanity. This is a political crisis. And then you have mixed messages coming out from political leaders and compared to the scientists and experts. That's like the first thing I learned in public health school. Unified message, unified communication. Like, say the truth and let people trust that they're smart enough to figure out what it means, but don't have competing mixed messages. Everyone is left confused.
Yeah, absolutely. I agree 100%. On the other side, I've got a kind of an angry one here. I'm not gonna read the whole thing, but it's about being able to trust our leaders, our health experts, our politicians, the people who are giving us advice. Particularly when we talked about the mask thing. I think we were debating masks in April, and we're still kind of debating masks now. Of course, there was the shortage, and I said you don't need them; they're not going to help. And now they really are going to help. You have to wear them all the time. And back and forth on that about we're gonna be locked down for a couple weeks, no big deal. Now it seems indefinite. People are getting tired of that. People were told that they couldn't go outside. Many people still can't attend a loved one's funeral or visit them in the hospital in certain places. Meanwhile, of course, religious gatherings are not allowed in certain places. But then people saw some hypocrisy when we saw the protests a month ago, or it lasted over 3 weeks, which tens of thousands of people out in the streets. And some of the same people who were saying don't go outside were endorsing the protests. So I think people feel they don't know who to believe, and they feel like everyone's either lying to them or has an agenda or doesn't know what they're talking about. So how does the average person, the layman like me, sort of wade through all that? Sorry, I just took a wheelbarrow and threw it on you.
No. I mean, I hear you. I feel you. I mean, I think we have to remember that this is a global pandemic of the magnitude of the 1918 to 1920 global influenza pandemic. Mm-hmm. This is a rare event in human experience. None of us have ever lived through anything like this. And the secondary effects, and because globalization has occurred and the interconnection of our economies that are global and that are linked to air travel and to gathering people together, I mean, the impact of these public health measures on the economic impact of that, I didn't anticipate kind of the devastating impact of the economic crisis, which is actually, it's continuing to worsen. Mm-hmm. There's been a massive job loss, a massive economic loss. And the United States has not been able to control the pandemic. It's spinning out of control. That is going to have that makes the economic impact last longer and be worse. So if we would have taken action to contain the virus, mm-hmm. then our economy could have, and people were saying this in March and April and May while the push for reopening was happening. Like, you're actually creating more economic havoc by delaying the process. So I think that because it's a novel virus, and we haven't had a pandemic with this particular strain of a coronavirus of this magnitude, we're all learning together. So the scientists and the public health measure experts are doing their best to gather information and make recommendations. We should consider that it will continue to evolve. Instead of being surprised that there's this or that new perspective, because there's so much research and study going on, so much analysis, the fire hose of data and information that people are processing, we want to be a learning humanity, and we want to get better at what we're doing. We're opening schools, you asked about. We're learning about schools. There's a scientific paper now that studied opening of schools around the world so that we can inform how we do it here. I think we should expect more changes. Face masks in the beginning were not thought to be as imperative as they are now. Yeah. But that is unique to our environment. In Asia, they had the MERS outbreak and the SARS outbreak, and they've been wearing face masks culturally for the last decade. So for them, wearing face masks is already something that they had gotten used to prevent infectious diseases. Now we're grappling with that as a culture. It should never have been politicized as a political statement. And, I think I haven't seen the definitive research yet on the protests, but many of the protesters were wearing masks, and there haven't been any reported outbreaks linked to the protests, as far as I know. Although I'm sure the jury's still out on that. Again, because it's outside, the wind's blowing, and all that stuff. But
Yeah.
I do think we should think about how to contain it at the community level in as many places as possible. That should be the goal, and keep the economy going and revitalizing it and recreating it for the 21st century.
Yeah, thanks for helping clarify that. Dr. Zeitz, I know your time is short, so I've got two final questions for you. Firstly,
you're tougher this time than in April.
Well, so just, it's a slow develop a rapport and then attack.
No, I mean, you've been keeping up on it, and you have like deeper, harder questions. So you and your listeners, and that's good.
Absolutely. Now, as we're waiting for our leaders to try to figure things out for us, and we're trying to think of public policy ideas and all that stuff, what can someone do personally? And I'm thinking, is there something that someone can take to help boost their immunity? I've heard reports about vitamin D deficiency potentially making you more vulnerable, something like that. Is there any kind of not simple, but is there any sort of things, vitamin C, vitamin D, or anything that you might know about that people can do to help boost their own personal immunity and their immune system?
Yes, thank you. I think mental health, stress reduction are also important for boosting your immune system. And yes, I think we talked about this last time, but I have published a blog, and there's been a good amount of research indicating that vitamin D, for example, has immune boosting capabilities. Mm-hmm. And in some countries, that's being rolled out as a part of a protocol. I did recommend vitamin D, vitamin C, vitamin and zinc as essential micronutrients that are part of the immune response. And I have been taking those agents myself as a way of optimizing my health. So I do, and they're over the counter. You can buy them at your pharmacy. And so I think I was advocating for those to also be rolled out to the most vulnerable communities. African Americans, Hispanic, and Native Americans have also been heavily affected, yielding the greatest burden of disease. So this is the kind of intervention that those folks can take pretty easily to optimize their well-being.
Great recommendations. Final question. Last time you were here, I asked you, what's the single biggest piece of advice you want to give to anybody watching and listening? And you mentioned the idea of social solidarity, people coming together to save lives. Dr. Zeitz, the country did not follow your advice. It seems like we're way further apart today than we were in April. So what can we do about this? That's a final question. Or is there some other answer now, since that didn't work?
Oh, now you're really challenging me, because I'm like, well, I still believe that. I mean, I think that we're all learning a really important lesson that science can be helpful. Yep. Science and experts can help guide the best decision-making by our policymakers. So I think that going forward, I mean, it's very interesting where, these states where they were opposing facial masks, they were politicizing it. Now they're all like requiring it. They were rushing to open up. Now they're all closing back down. So they've learned their lesson the hard way. And unfortunately, people have had to die from that and needlessly suffer. So I'm committed. And I think my message today is like, we should be committed to saving as many lives as possible while reigniting and retooling our economy for the 21st century. We can do we can do both. We can walk and chew gum as Americans. Yeah. We can do much better at controlling this pandemic than we've done. Look at all those other countries that have been successful. America has never fallen behind this way in a global public health emergency ever before. We led the world in polio eradication, in smallpox eradication, in controlling diseases like HIV and TB and malaria, other things. Like, this is an embarrassment, and we should hold ourselves to a higher standard. So I would say hold America's standard to a higher level. Like, we can do better as Americans.
Yep, I agree. I agree. Thank you so much for coming on, Dr. Zeitz. Maybe we can chat a third time, hopefully not about the COVID-19, maybe over something else. If people want to stay up to date, follow you, follow all your projects and all the stuff that you're working on, how can they do that?
Thanks, Dave. Yes, I'm happy to come back. Unfortunately, we're going to be dealing with COVID. So even later this fall or whatever it might work for you. I hate to be the bearer of bad news, but it is.
I get it.
Please follow me at my website, drpaulzeitz.org, or I'm the executive director of Build a Movement 2020, which is a political advocacy engine. And that website is bam2020.world. I'm also on Facebook and other social media.
Great. Thank you so much for coming on.
Thanks.
Well, I hope you enjoyed this conversation I had with Dr. Paul Zeitz. He really is a great resource. And if you did, please hit the like button. And I would be honored if you would subscribe to this channel. Also, head on over to realhealthynews.com where you can get more information, just like the stuff Dr. Paul Zeitz and I discussed, and for you to get real healthy news in your inbox. Thanks for watching.